Come in.
Hi, my name's Caitlin. I'll be your occupational therapist today. What brings you in today?
Well, Caitlin, I've been having a really hard time with breathing lately. Even when I do my exercises, I'm out of breath, and I feel a lot of pressure and pain in my chest.
I see. All right. I'm going to go grab our respiratory therapist. I'll be right back.
Okay.
Hi, I'm Josh Ventura, and I'm a respiratory therapist at UCLA Ronald Reagan Hospital.
So, what does a respiratory therapist even do?
So, as a respiratory therapist, I assist patients whose respiratory systems have been compromised by some type of disease process or injury, and I help bring those patients back to original health, as well as patients who have been born with some type of respiratory disorder. If that is not correctable, I, as a respiratory therapist, would help maintain their health from then till now.
Sometimes respiratory therapists and occupational therapists work together.
Do they?
That's a great question.
So, from what I understand, a part of what an occupational therapist does is you decide what a daily plan after the hospital visit for the patient is, and if that plan consists of something that deals with the respiratory system, that's where I would come into play. I would work with an occupational therapist to determine what the best and most efficient plan of action is for the patient when the patient goes home.
Can you tell us some more?
Times a client would be referred from an OT to an RT are usually when there's a respiratory issue that an OT couldn't resolve. If you need my resources for something, like if there's some piece of equipment that you need that you don't have, or if you just overall don't know how to handle the situation, that's when I would come in, give you my 2 cents, or the equipment that you need. Since RTs are continuously educated on learning about new equipment and medications to assist with respiratory health, that is where I would be able to assist an occupational therapist, because I would assume that we're educated more diversely in that specific field, and there would be some types of technology or new medications that you might have not heard about that I could possibly bring up for the specific patient and the betterment of their respiratory health. So in that sense, that would create more efficiency and more comfort and just a better overall life for the patient afterwards when they were to go home.
Do they always work together? What's a typical day for a respiratory therapist?
So a typical day, that would actually vary depending on the floor that I'm working on, because I work on pediatrics, I could be working on ER, adult ICU, geriatrics, or just the basic floors, and with each one there's a different type of demographic and a different type of disease process that I have to attend to. For example, in the ER, anything could happen. I could get a gunshot wound, or a gunshot to the chest, or I could have a asthmatic, or like I said, anything could happen in the ER. And at that point, those patients are highly unstable, so it's a little bit more stressful. But in the ICU, these patients, I wouldn't say they're fully stable, although they're under everyone's service, so we know their history and they're most likely on life support, and they're just more stable than they were in the ER. So a little bit less stressful, but they could go downhill anytime. And the basic floors is just delivering medications. So, I'm just going around saying hi to people pretty much, giving them their meds. And children, that's another story. You could be delivering medications, or you could be managing their life support. And with that, that's a totally different world actually, because you just have to maintain them in a different way than you would with adults. They're just more sensitive all around.
Like an occupational therapist, respiratory therapists can work in many different settings.
So I've been practicing respiratory therapy for about 4 years, and I work with a variety of patients, and it ranges from children to geriatric patients to people around my age. And the type of disease processes, it's a wide range as well. It could be cystic fibrosis, IPF, or just like typical injuries from car crashes, blunt injuries, or or disease processes from birth.
Well, you know, Caitlin, respiratory therapy sounds really cool. Maybe I could do something like that one day. Do you know what, like, the schooling process is for that?
I don't know. What do you think?
I attended Mount San Antonio College, and it's a 2-year program. They gave me an associate's degree, and after that, I attended an online school where I got my bachelor's degree. So the requirements for that, of course, are just the same prerequisites as it were in nursing, or I would assume in occupational therapy. You know, typical chemistry, biology, basic math, and then after that you get into your actual major. Clinical hours that you have to attend to, and I can't actually remember the exact amount of hours that you have to attend, but it was just a whole year of clinicals. I believe it was three days out of the week, 12-hour shifts.
It seems like respiratory therapy is really going to help me. Thank you for referring me to Josh.
Of course.